Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. Today we are doing reading part B and C, and I'm just going to go through this reading part and we'll see whether these questions are nice and how to execute it in the exam. So please stay motivated, subscribe our channel if you have not, and please look at these videos nicely. Which of the following is not one of the aim of the trial? So my question is little tricky in a sense. My question is little tricky in a sense because it says which is not one of the aims. So this word gets missed sometimes. Not. Very, very important. Which is not one of the aims. Treatment for the heart attack. Nearly 400 hospitals in Britain and Australia, New Zealand, Canada, Ireland, and US and Europe have a large black suitcase from the organizers of the second international study of this. Oxford in Britain, the suitcase contains packs of treatment for the patients who have just been admitted to a hospital after a heart attack. So they have just got admitted. And what is in the suitcase? It contains pack of treatment. So now the only thing I can, until now there is no aim. My question is about aim of the trial. But what I can understand, there is a suitcase that contains the pack of the treatment for the patients who have just been admitted. It's a passive voice. Who have been admitted, just been admitted. That means they just had a heart attack, and passive voice, who have been admitted in the hospital. So that is what we do when we do OET writing as well. The patient was admitted. Today, the patient has been admitted by us. So has been admitted means by the staff. So has been plus third form means a passive voice, means it is by someone. So again, but that was explanation of grammar, but this is not required because it doesn't say about the aim. So first paragraph is waste. That is why I did not invest energy on the first two lines. The aim of the trial. Now my mind becomes super active because this word is matching with my question word aim. The aim of the trial is to test two treatments in the patient soon after the onset of their heart attack. So two treatments is the aim. Most heart attacks are caused by the blood clots forming in the vessels that supply to the heart muscles, the coronary arteries. The first treatment is the intravenous streptokinase. So this is my keyword. First treatment is this, a drug that dissolve this blood clots, so improving the blood flow and limiting the second treatment B strategy is ordinary aspirin. This is my second treatment, which by reducing the blood flow, so it reduces the blood flow. What the first drug does, it dissolves the clots. And what this drug does, it reduces the blood ability to clot. Again, the same thing. And reduce the risk of further attacks. Since the organizers are interested in analyzing the active drugs with a placebo and not with each other, this line is very important. They want to analyze the active drug with placebo and not with each other. That means they don't want to compare streptokinase with aspirin. They do not want to compare these two active drugs with each other. They want to compare the active drug with placebo and not with each other. They have adopted a factorial design. So I've got the paragraph nicely. Let's see, these are my keywords: IV, then ordinary aspirin, and analyzing the placebo and not with each other. This is the aim of the trial. This is the main aim. So to contemplate streptokinase, yes, streptokinase with aspirin as a treatment in, no, I don't think so. But contemplate word is little tricky for me. If they said compare, then to 100% my answer is this. And my question is note. This I should, this, see, I forgot this thing. Note one of the aim. So I'm not quite sure about the first option. So when I'm not sure about the options, I do not overstress because I believe the next two options should be easy. So if there is any word like contemplate over here, which is disturbing me, I do not pay or spend my energy on it. This is the main trick of saving your energy, making your reading better, that when you are stuck somewhere, leave it for a moment. Please leave it. To test streptokinase in the heart attack patients, yes, this was the aim of the trial. To test streptokinase in the patients, yes, so B is right, but my question is not one of the. So this is the aim. So this is not my answer because I have to find not one of the aim, but this is one of the aims. So this is not my answer. To compare streptokinase and aspirin with placebos in the heart attack. So that is also good to compare active drugs with placebo, that is also given. So the one I am confused is to contemplate and aspirin as a treatment. So that is where I think A should be the answer. But this again, in exam, I cannot be super confident. But again, the main thing I want to teach you here is to save time. So I will do A and will march forward. This 100% is not my answer. B. C, I am little confused to compare streptokinase and aspirin with placebos. Yes, but it is also given to analyze active drugs with placebo. So with word is also falling at the right place. Active drugs means streptokinase and aspirin. These are my active drugs. And over here they have named it this. So these two active drugs with placebo. So this is making a lot of sense. So this is also correct. B is also correct, but I have to find not one of the aims. So A should be my answer. So I will not spend too much time. I will march forward. That is what is required in reading. Save time. Save time. Second question. Let's go to the second question. According to the writer, method used today to cure prostate cancer. So the main word that you should understand is today. Because if this word is not important, why would they have given you this strange word? So today means it is a special word. Most of the times you need to note these kinds of tricky words, that methods used today to cure prostate cancer. What are the methods according to the writer? Okay, let me read the paragraph. Prostate cancer. Growth tumors in the breast and the prostate are stimulated by the normal hormones. In man, these compounds are known as androgens, are produced by the testes and the adrenal glands. So the main cancer causing hormone is androgen. So this is the hormone. I will name it A. A for androgen. So A is the main hormone that is causing. So diminishing the levels of A, diminishing the level of A is known to have an anti-cancer effect. So I have to decrease the level of A. The current method, oh my God, this is good. Today, current. Wow, I could see something. The current method to downturn means to decrease A levels result in a number of serious problems. The current methods to decrease A lead to serious problems. The drastic measure, castration abates level of A, such as testosterone in the body. So the drastic measure mean a kind of a very severe measure, which is castration, abates level of androgens. So it decreases. I don't know the actual meaning of abate. So abate may be decreasing or cutting off the level of androgen, such as testosterone, but fails to prevent androgen secretion by the adrenal gland. So means even if you do castration, it decreases the level of androgens, but it fails to prevent androgen secretion by the adrenal gland. So it is not an effective measure. It is one of the current methods, castration, but it is not very active because it does not prevent androgen secretion by the adrenal gland. So it is not very effective. In the second therapy, commonly used for men with the prostate cancer, doctor administer the female sex hormone estrogen, which counteracts the androgen. So estrogen will be opposite to androgen. So if you have the female hormone, then it will counteract the male hormone. So it will counteract means it will react against it. But this procedure can create cardiovascular complications, enlarge the breast, and can cause impotence and loss of libido. So these are the side effects it can do. So there is the mentioning of two important procedure. One is castration. Second is this estrogen therapy. But again, it is also not successful. Another way of reducing level is to use the drugs that disrupt the hormone signal from the pituitary gland that stimulates the testes to make androgen. So another way of reducing is to use the drugs that disrupt the hormone signal of the pituitary gland. So if the hormone signal will be disturbed, then it will not produce androgen. So this is the third method. Various pharmaceutical companies are currently investing. So these are the current methods. So what are the current methods? If I have to underline only main points: castration, estrogen, and changing signals, disrupt the hormone, changing signals. These are the three, 1, 2, 3. Methods used today to cure prostate cancer block the production of androgen in the adrenal glands. Now I would like to read. Block the production of androgen. But this first thing is that it fails to prevent androgen secretion by the adrenal. So it cannot be one of the methods, because they are saying it cannot prevent, and this is saying block the production of androgens. So they are saying that you cannot block the production of the androgen in that. So this should not be my answer. Decrease the amount of androgens in the body. Yes, these all three methods were saying to decrease. Even here it was saying decrease. Even here it was saying to reduce the level. So this is a common phenomena. So all the methods are trying to decrease the androgens. Let me see the C option. Interfere with signals from the pituitary glands. Another way is to use the drugs. So drugs word is missing. First drug word is missing. Current methods is to cure postcancer, interfere with the signals from the pituitary glands. Use the drugs that disrupt the hormone signal from the pituitary gland. So this is also good, yeah. All the three options. But this is only if I have to do only one. But in this paragraph also current word was not given. One thing this is creating doubt. And the other thing that is creating doubt is drugs word is missing. And third, if I take about B option, decrease the amount of androgen in body, that this method also does, this method is also. So overall, the current methods are trying to downturn androgen level. So this is a complete guesswork. Obviously, B has more chances, so that is why I'm putting B, but I cannot be sure about this answer. Like in the first question, I was more sure about the answer, but second, I'm not quite sure, but it should be B as per me, because drug word is missing, and interfere with the signal and disrupt the signal can be same or opposite, but again that is only the third method, and in this current method is not said. So if I have to take the chance, I will go with B, because B covers all the aspects, even the castration, even the estrogen, because all these methods, all the three methods are trying to reduce androgens in the body. So I would go with B, but again, I cannot be sure about this. So this is how you do reading in your exam. But still, before I stop the recording, I will like to check out with the answers with you guys. So if you can help me, that would be awesome. Please, guys, first and second, so that I can
Both
stop
are
this.
correct, sir.
Both are correct. So basically,
Yes.
what I have done in the first is that to compare streptokinase and aspirin, they were saying not with each other, not with each other. To test the streptokinase in the heart patients, yes, it was saying. So this was the thing that they were not aiming. They were not trying to compare these. Oh, sorry. They were trying to compare two active drugs with placebo. So to compare streptokinase and aspirin, that is active drugs, with placebo. So that was given true. And to test streptokinase, that was given. That was the first thing they wanted, true. This they did not want. That they did not want it to compare streptokinase with aspirin. They did not want two drugs to compare with each other. So A option went out because our question was what is not one of the aims. The second was little tricky. It could have been C as well. If by chance you have done C, that doesn't say your reading is not good. It's just the question that is little tricky. But yes, B option is much better because it covers all the aspects. Okay, guys. So I'm just stopping the recording and then we'll take your doubts again. This is Dr. Bhupesh from Dr. BKM Institute. Please subscribe our channel if you have not, and always watch the video till end. Thank you.